Call this my Britney Spears mic.
Good afternoon, everybody. We are live. All right. Can everybody hear us? We are live. Oop, let me mute mine. Mute. We're going to wait for, oh, there we go. We have some feedback. Perfect. We have some dogs barking. That was planned. All right, today we have Chief Morelli and Zeppetto here. Do you guys have any specific questions ready for them? They're ready for those too. So I wanted to start by bringing up this document that we were talking about last stream. I wasn't here, but I think we were working on this together. And this is kind of where we landed. Doc will be here in a few minutes to go over the daily numbers and everything with you guys. But in the meantime, I just wanted to bring this up because this is pretty much the final. The only thing is we might change this question. Have you been tested for COVID or diagnosed with COVID to a yes or no question? That's the feedback that we received this morning. And you'll be able to put this will go out to all of the different agencies and you'll be able to put your picture on here and have this laminated to communicate with your patients. So if you guys have any more feedback on this or anything that you think that would help with communication, please put it in the comments or the question section so that we can work on making some of those changes. I'm going to leave this up here for just a minute, see if anybody has any feedback on this.
I think it looks pretty good.
I think this will be a good tool.
Yeah, I think this will be a nice tool, exactly a tool in the toolbox to use. That'd be great.
Yeah, and a reminder just to, find different ways to communicate with your patients.
I'm waiting for somebody to, put Brad Pitt's picture in there.
Yes.
And this is what I look like underneath this mask.
You could be just a picture from, 30 pounds or 10 years ago.
Yeah.
You could be whoever you want to be right now.
Yeah, exactly.
Thank you, COVID. All right, so no real feedback on this, so I'm going to stop.
How many do we have on, Jasmine?
We can come back to this. Let's see. I have 37 on this screen, but it kind of lags, so let me look.
That's what I got too.
So, yeah, we're at 37 right now. So hopefully we get some more people logging in soon. I know that we haven't had very many changes, so there's not quite as many questions, so our viewers have gone down. But we do see about, I want to say 600 to 900 people that watch this after it's already posted. So,
well, let me say something. Let me just say thank you to everybody and happy EMS week. Even though there's not much happiness right now.
Yes, happy EMS week.
Yeah, thanks to everybody for what you're doing. You guys are doing an amazing job out there. I know it's hot. It's ridiculously hot now in all this PPE, but we got to stay the course right now. We can't let our guard down, but thank you all for what you're doing. And you guys are doing a really fantastic job out there.
All right. Doc says he's still in the county commission meeting, but he'll be here soon. Happy EMS week to everybody. I did want to say we are not super excited, but I want to let you know we made some good CME videos. We're trying to keep them engaging. So you're going to have 2 CMEs come out at the beginning of June. The first one's going to be a regular pediatric CME. And the second one is going to be everybody in full PPE and treating patients and how to communicate with patients and things like that. So you'll see that coming out. There'll be a longer timer since you're getting 2 CMEs in 1 month, but we're addressing some of this COVID stuff in our CME videos now. And some of us that aren't out there so much put on some Tyvek suits and pull PPE and videotaped in the sunshine for a couple hours working, simulation codes so we can get a little feel of how hot it is out there for you guys. So we know it's hot. Chief Morelli, you have anything going on in Seminole today?
Yeah, happy EMS week as well. I think we're running in obviously the sun and the heat, but we're also, remember, we're running into that rainy season. And as that rainy season comes, I think we're going to be challenged even more so with stuff fogging up and different things. So I know that we're all looking at different types of solutions and different ways to try to make these things a little bit better for you, PPE wise. Wearing it there, I know that they've got out the solutions to like the defogger stuff. So hopefully that's helping. I've heard nothing but good stuff about it, at least from our agency. But once again, thank you guys for all you're doing. We really appreciate it.
Throw your questions up here if you have any. Also, now is the perfect time for suggestions about communication, because we're going to be adding those into our CME content. Anything that you suggest that works for you to engage with your patients or communicate is really going to help other people. Are we preparing for not only a potential resurge of COVID, but of people who have lost their jobs, health insurance, EMS, ERs, primary care, driving, call volume? So I believe our call volume is starting to ramp up a little bit, and we've had some more overdoses. And I know last week we talked about having some more boat fires and extrications. The beaches have been pretty packed. So we're seeing things, start to go up, not just related to COVID, just people being outside and, having a little bit of cabin fever. So we are preparing for those things and trying to get ahead of the PPE. You guys seeing the same thing out there?
Yeah, obviously call volume now that it's picked up. Obviously the auto accidents are up, and then even the cardiac arrests I noticed are jumping back up to their normal, if not even spiking a little bit,
Yeah, I'm sure the doc will talk more about hospitals and stuff like that. But yeah, we're seeing, same thing, and everything's trending up. So I as far as the resurgence or another spike, that's what we're trying to avoid. Hopefully we do avoid that. But you don't know when that other spike could come. The doc was talking on our LG meeting today that spike could be, next week, or that could be in the fall or in the winter, depending on when a vaccine is created, and they're aggressively working on it. But his indication is still that that's months and months off. So yes, we are still, as far as the county is concerned, and what we learned at meetings today is that the county is still purchasing PPE. We're still staying the course of that we're going to be in this for a bit longer. We may hopefully go into a lull, and maybe we can keep the lull down and keep it for a long period of time. But we are going to continue to plan as if this will continue for a while.
Yeah, and the demand for PPE is going to continue to go up as things open up, and businesses and other surgery centers need it. So we're working on trying to stay ahead of that. We're doing the best that we can. Yes, you're going to have to stay in your P100s for a while, but if we have any alternatives, you'll be hearing about those as soon as we have something. I think that it's been kind of up and down with everything opening up, but we'll see what happens. I think we expect another surge in the winter next year if it follows the pattern of most of the viruses that come out, but hopefully we can try to do our best to continue protecting ourselves in the meantime.
I don't know if you want to wait for the doc, or do you want me to talk about the little speaker and the communication issue that we
I think that some people will get some use out of that are watching this. So I think now's a good time. And if they don't catch it now, they'll catch it later. So
copy. So one of the things that we realize is a problem is using those P100s in the full face mask is very difficult to communicate. So one of kind of the solutions that we've been looking for and experimenting with some different things is that we were able to source a little speaker and a microphone off of Amazon. And I will share the link with you guys here in a minute. But we found that this seems to work very, very well when communicating with patients. It's easy to decon. It's charges. It's a Bluetooth speaker. It's waterproof, dustproof. shock proof, although I don't know if it's firefighter proof or EMS proof. We'll probably find out in a couple weeks when they bring me parts back, but so far so good. The microphone itself is not the greatest, but we have ordered some separate throat mics. I know the guys are excited, the guys and gals are excited because they think they're black ops now once we get them. But simple thing, and I don't know how well the camera will pick it up, but it's a tiny little Bluetooth speaker like so. And I'll share the link. And it comes with this little microphone. And what we found is that as you're putting your PPE on, you can take this, comes with a clip in the back, and it also has a strap that can go around your shoulder. And the guys and gals are using it around their shoulder and then throwing their gown on. And then they take the microphone here, and all we've done is kind of just taped it to your throat like so. And it amplifies the volume, your voice tremendously. It's really helped out with the elderly. They're able to hear us. You don't have to scream at people. It's got the little windscreen on it, which we've tried it with or without. I don't know how well that'll hold up or decon wise, but we were just wiping them with hydrogen peroxide and seems to be working pretty good. I don't know if it'll demo right, but I'll give it a shot. Let me turn it on. It makes beautiful sound. Sorry about that. Let's see if it'll come through on the camera. But if I just place it right here, I don't know how much louder you guys can hear me, but it's just sitting right there on my throat. And it seems to work very, very well in communicating with the patients. Now, obviously, it's got a lot of feedback when you get the microphone in front, but we haven't had that issue as long as you keep it away there. But it's a pretty unique item. Let me see if I get a little savvy here, if I can share the screen and the link. Can you see that, Jasmine?
Yep.
Okay. Like I said, it's $52.90. It came within the Prime shipping. It was here in 2 days. We had it. We've been testing it out. And it's made for outdoors. So like I said, it's shockproof, dustproof, waterproof, and it seems to work very well. I know that the guys were using it off of 29 the other day, and that seemed to work very well. I know they talked to several people out there and some other Sunstar folks they were working with. They said, wow, that's fantastic. So it's worth it to give it a shot, something that you're really struggling with. I noticed with the half face masks and the N95s, you really don't have that much issue speaking, but the other ones are causing those problems. So and I'm welcome if anybody's interested or they want, they can speak with our folks or, give me an email and shoot me an email and we can work with you. So.
That's great.
That's it's a good workaround. It's a good way of solving the problem there. And I'll also say that I think you have the most tabs open on a browser that I've ever seen in my life.
You ever notice when people share their screens, what's at the top?
Yeah. And I have that data. If you guys want to see the data, I know obviously Doc's going to be the one to kind of explain it all to you, but I'll let me see if I can work this here again. As you can see all my tabs, because I'm always looking at the data constantly. See if I can get this to work. But this is a nice little snapshot of the county right now that you can kind of look at and let you see what's going on. And everybody can see that, right, Jasmine?
Yeah, it looks good. I think a lot of us are checking this out daily, but if you're not, it's nice to have the update at least once a week.
Yeah, and this is great information to look at, and you watch it as it trends, and it's kind of neat to see as things started opening up. If you look at May, we've kind of had a spike in cases that have popped up in our county, and now we seem to be trickling back down. I don't know if that's circumstance or that's really truly of back opening up, if that's an indicator. I don't know. I'm sure Doc can speak more on that.
Yeah, or testing. I mean,
yeah, or testing. But this is right around, I believe we started May 1st, I believe. They started opening things back up. Correct me if I'm wrong.
it was the 4th.
The 4th?
Yeah, 4th, yeah.
So, you know, you're almost at that time where you're almost at a 2-week mark where it's come up. So
now they're opening up gyms and movie theaters and places indoors,
right.
but we're a little bit more concerned about spreading, obviously. So it'll be interesting to watch how this progresses. And I think this is something we're going to have to keep in mind next year when this starts, you know, after we get through the summer. Obviously, it's important to remind everybody that this is not over. Just because things are opening up, and we are going to continue our PPE. We are all seeing people getting a little bit lax with it, and we don't want that. We still need to protect ourselves. But as we get through the summer, it's going to be hot, and we have to just keep remembering that this isn't gone just because we're calming down a bit. But
I don't know if anybody's, yeah, that's a good point, Jasmine. I don't know if everybody looks at the John Hopkins one, but they have some really good, neat reports to look at. And this is an outline of our county and kind of gives the numbers laid out in a nice, easy way to look at. Good to present to people and kind of look at those statistics. But this is the John Hopkins website. When they added the United States portion about a month or so ago, you can actually drill down onto some neat statistics, you know.
So there's a couple of questions coming through, but those will be good for the doc to answer. I don't think we would answer those.
Douglas Gladstone, the speakers and the microphones that he was talking about, those just got brought up today in one of our meetings. So no other agency has purchased those yet. That the suggestions out there if anybody wants to purchase them or talk to their agency about that as an option. So this is kind of just the beginning of this. Seminole started purchasing them themselves. So I don't believe anybody else has done it yet.
Yeah, and if anybody wants information or they want to kind of see how it's working out, the guys at 29 have it now. This one's going out to 30, and I got 4 more coming this week. So we should have them on every unit. So if you're running calls in Seminole, you can really kind of see how it's working and, you know.
Mr. Microphone from the 1980s.
Yeah, exactly.
A little more advanced.
Yep.
A little bit more advanced. So the question to everyone out there that I was kind of asking earlier in our meeting was, has anyone out of the people that are watching this right now, what are you seeing as far as the public being tested? Is anyone running across people that have shared that they've been tested, or do you know of people that have been tested? I'm kind of trying to get a feel of how much testing is really going on out there in, you know, Pinellas County, Hillsborough, kind of tri-county area, or, you know, 4-county area, I guess.
There's asymptomatic testing out there and antibody testing out there outside of the testing that we are doing. So I don't know if you guys have heard anybody or are seeing people take any of those tests.
I just received word through some friends that I saw that now if you donate blood, they're doing free antibody testing when you donate blood. I don't know if that's a push because they need blood and they're trying to get people to donate, but that's something that they're doing now through OneBlood.
That's great. All right. Have you guys heard anything about this, or do you want to wait for Doc? I'm seeing a lot of information on social media. It's very important when you see that information come out to look at where it comes from. So,
yep. You need to have good sources.
There's just as much information to combat anything. So you really have to, you know, go back and see where your research comes from. And just because it's a research study doesn't mean it's a good one. So you have to spend some time looking backwards. Make sure you know where the information's coming from. Read past the headline, that kind of thing. But I think that's some of these questions are pretty good. Yeah,
Yeah,
no, that's a
they're
good,
very good
that's a
questions.
good question. I actually haven't looked at the studies related to that. I haven't heard about that until I saw it on social media. So I could probably take a look at some of those studies and see what's out there. But that was the first I'd heard of it. I was kind of surprised that that was going around with all of the ups and downs about opinions about masks in your time that you're not at work.
I see Chief Tokar's put karaoke time.
Yeah.
Yes, you can play music through this and sing if you want.
Yeah.
It has that option. It's a Bluetooth speaker.
Zepeto, I think the request was for you to do karaoke.
I don't think you want that. We're good on that one. I don't have the fancy setup like Doc does with all the music and the sound effects and the.
He's ready for his podcast to get started.
Mm-hmm.
Right. I still haven't seen anything come through about communication, anything that's helping with communication or that's hindering you with communication out there.
This looks like Adam Stacy is what's the decisional tipping point for an evacuation of a long-term care facility?
That's a good question.
Yeah, from our experience, what I can tell you is that has been decided by the Department of Health and ACA of when we're doing that. But my suggestion was that while we're out there, I'm sure Doc can speak more on it, is that you make sure we're out there contacting those long-term care facilities at least weekly, if not daily, just to check on them. And when you're running calls there, if you have issues and you see changes occurring or a spread or people not wearing PPE, report it to your EMS coordinator right away. Because if we know about it, we can address the situation and get involved, because sometimes maybe the administrators don't even know. They should, but doesn't mean that they always know what's going on during the night shift or anything else. So it's super important that you keep the EMS coordinators at your agency in the loop of what's going on.
Every agency should be working with nursing homes in their area. Even Sunstar is in the nursing homes helping support out with support testing. But right now we are working to help support the nursing home. So when we go in there and we see something that's not working, it's often because they just need some help or some education. So when we report something or to a supervisor or say something about what's not working there, the goal of that is for us to support them and make sure that they have what they need and the education that they need to keep themselves and their residents safe. So it's not, we're not going in there saying, hey, you're doing this wrong. We want to report you. We're doing this to really support and help other people that are at risk in our community. So keep that in mind. If you see something in there, you can help educate, and you can also let your supervisors or EMS chiefs know, and they can go in there and make sure that there's some education and some PPE gets into those facilities if they need it. And obviously, if they become overwhelmed and they have too many COVID positive patients, then everybody kind of works together to decide what the next move is. And sometimes that is evacuation.
Yeah, as far as the tipping point, that's specific to every case. It depends on, like Jasmine said, the amount of patients they have, the staff they have, if they're overwhelmed, amount of PPE they have. There's a lot of different aspects to that. So I don't know if there's actually there's not a playbook. There's not a single, this is the answer. So the state, ACA, state, and county all work together to make that decision as to who goes where and what happens.
And you guys have all been doing a great job. We've got people, every department's been out there working with nursing homes in their area to try to do the best that they can to make sure everybody's prepared.
Right, and that's the key, is just making sure we work as good partners with them, making sure we're protecting our vulnerable population, and let them know we're there to assist and whatever they need that we can help out. Because I can tell you, and I can speak from experience, that when those poor nurses and doctors over there get overwhelmed, they really need the help, and they want it, they beg for it, and then they're very willing to ask for it.
If you guys ask questions in the comments, Doc is also on here answering questions in the comments because he can't be here face to face right now. So he will jump in eventually, hopefully. But we are here for your questions as well. Let's see if we missed anything that we can answer in here. Anything else? Not too many questions today. We only have 42 people watching. We're going to continue this on Tuesdays only. And then if we don't have too many changes going on, we'll start slowing this down a little bit and then ramp it up again as needed. So yeah, we can, we have some different guests that we'd like to get on here too when they have time. All right, not too many questions. Update on responder testing. So I can get into that, or Chief Morelli, do you want to do some information about what we're doing with the testing right now?
Yeah, I can speak to a little bit about that. And I know the doc they have gotten some tests in and they're doing a little bit of a study right now, and hopefully to accomplish that this week through Seminole and I believe Safety Harbor and Sunstar. We're going to get some folks in and get them tested. They're going to kind of do a little bit of a testing, and they're partnering with the Tampa General. So we got some folks, about 20 to 30 tests that we're going to get done. We're going to go run them through. We're going to do the finger stick, the IgG tests, and kind of get your results there. And then they're also going to take some blood and then have it validated with Tampa General. With the doc had made a great partnership over there to make sure that he can make this happen. And so hopefully we'll have that this week and have some validation of the tests so that we know what, before they start rolling them out, that they're working, everything's good. And that is the plan so far.
And some agencies have already been testing, but this is a little bit different because these are the tests that we're going to use, providing everything goes well with this round of testing for everybody moving forward. So if you've already been tested, that doesn't mean you won't be asked to be tested again.
Yeah, remember, testing is just a snapshot in time, unless you're talking about the antibody, which gives you the past. It's just a snapshot in time. So it doesn't mean, you can't walk out from getting tested and still contract it. So even if you have the antibodies, Doc will tell me if I'm wrong, but that's not, herd immunity has not been proven yet, beyond a shadow of a doubt, that we can have herd immunity by just having it one time and not having a resurgence or having it come back at you. So just remember, that's always just a snapshot in time.
Yeah, that's very, very good point there, Chief. We don't want people to think, oh, I'm good, and you run out and you're not protecting yourself, because you really still need to take those precautions. And, everybody has to evaluate your own risk off duty, on duty, make sure you're always wearing your PPE and stuff that's provided for you, because a lot of folks work really, really hard to get you this PPE and continue to work very hard to get you that PPE, because the ultimate goal is for you guys to go home safe to your families, and that's what we want.
Absolutely. Peg had a good question or a good comment. There have been many overdoses also. Where are you seeing is there a theme to that, or is there is there depression to that, or is it what?
Yeah,
what are you seeing out there?
We've definitely seen a spike in overdoses. I think people have just been cooped up at home and they're finally out. We're saying that it's kind of like a spring break out there right now. So
recreational, is that what we're saying?
Yeah.
Oh, okay.
On the beach. I know there was a couple this weekend.
Gotcha.
And not just on the beach, but I've heard about a couple of those.
I didn't know if it was intentional, meaning to harm yourself.
Yes, we have a very high number of patients in the hospital that are COVID positive right now.
Yeah, with the trend even that you're seeing in overdoses, we're also seeing in domestic abuse in some areas as well, because people are not used to being stuck in the same house for such a long time, I think. And so that seems to be on an upward trend as well, a little bit. Things that we need to look out for, and even just people arguing and fighting over. I know I was at Lowe's the other day and I saw people screaming at each other because somebody cut in line for a plant. So there's some crazy stuff going on out there.
A lot of tension.
Yeah, apparently everyone forgot how to drive while they were in their houses for the past month and a half, because that has gotten crazy too. I noticed a lot more offensive driving versus defensive driving, a lot more.
I think a lot of us were getting used to the roads being pretty clear. So obviously that's driving our call volume up just a bit, that we have people out there driving and car accidents are coming back and more overdoses. I don't know, Peg, it could have been a bad batch, or maybe people are out there using more, or there's more available because there's more people out there moving around. I'm not sure. It'll be interesting to see if that continues. Oh, I must have missed Doc's rhyme. Let me go back.
Your doctor.
It was about the spike.
Right. Tough crowd. Yeah, we're keeping him entertained for you, Doc. Don't worry. We're at 51 now. So people just tuning in, if you have any questions or any input on things that will help with the PPE that you have been noticing, any challenges or anything that is working, please let us know. That would be good. I'm sure he's full of meetings just like us, but he does have a lot of great information. Always, I'm sure, even more around pediatrics and COVID. That's a good question. If those are long-term care facility patients or if they're from the general population. Yes, because we did move a lot of patients to the hospital over the last little while. All right. I'm going to go back up and look for more questions if you guys keep them coming, so we see what else we have to talk about today. I'll look at some research on the use of masks, and what was it? Long-term use of masks and hypercarbia, I think it was.
Yeah, I believe that.
All the content on social media, I didn't see any research studies behind it, so.
Hello, hello.
Oh, welcome. We've been waiting for you.
Well, they just did the motion. I can't help the public comment at the Board of Commissioners meeting. You all know how that goes. We were agenda item 12. So let me get set up for this meeting. Here we go. I had to keep the professional background on for the other one.
That background's better.
That's good, right?
It's definitely more of our level.
Yes, mine too. All right, so I was trying to answer questions in the chat room, but what did I miss?
I think
so Morelli went over some of the statistics. But if you wanted to go back over them, that would be good.
Okay, what do you want to know?
So he went over the numbers and what's going on in the county, not over the number of patients in the hospital. But if you wanted to give some more insight into that, we did that already. And we've been just trying to address some of the questions in here.
Sure. So today, I think the number was 169, if I remember correctly, patients currently hospitalized in Pinellas County with COVID. Very small number of those are in ICU, and very small number, actually not a very small number, 40, I want to say 40 something are in the ICU, but only 7 or less than 10 are vented. So there are certainly, there are certainly more people in the hospital in Pinellas today than there have been previously with COVID. But a large number of those folks are from long-term care facilities, and a substantial number of those folks are from long-term care facilities that are already probably in the convalescent phase of their infection, but have not yet been able to be discharged to a nursing home that would take a post-COVID patient. The state made some rules about 2 negative swabs to be discharged to a nursing home, so that's slowed that process substantially. Mark, what did you sing?
Are you preparing to sing again?
I want to hear it.
I didn't sing yet. Not
You
yet.
can't sing yet. It's coming.
Oh,
I've already been challenged by all my guys at work. So.
all right.
Hey,
Well,
Doc.
so yes, sir.
Is there any statistics on patients in long-term care facilities that are diagnosed with COVID and what's their recovery rate?
You mean is it like how many of them live versus die?
Yeah.
I don't know specific to long-term care facilities. I don't have a number off the top of my head, but these are the definition of the high-risk individuals.
Sure.
Now we did Seminole, right? Seminole Nursing Pavilion.
Yeah, I got some of the numbers there, you know.
Yeah, so the last number I saw there was, you probably know better. Do you know the last numbers from there?
I believe we saw 31 or 32, somewhere in there.
Yeah, I think I was right around 30 residents and 1 or possibly 2 staff members.
1 staff member, and I thought around 31 residents, but I could be wrong.
Yeah, so that adds up to about the 32 I had in my head. Okay, so out of 105 total, right?
Yep.
And I don't know if all 105 eventually tested positive. Do you know that?
I do not know.
I know at least 80 or so tested positive. So if there were 80 positives, 32 out of 80 is a much bigger percentage than 32 out of 100. But even if it's 100, that's 30%. That's a huge mortality burden.
Yep.
If it's the 80, then it's pushing 45% or something. Never do public math, right? Either way, that's a massive, massive mortality burden. So
Doc,
not good.
You showed an image this morning of the choir practice. You showed that,
Do you
right?
want to see that?
Yeah, I think that's good. You should share that.
Okay.
When we talk about PPE usage and then,
Yeah, I thought it was a really impactful image. It was in a journal article. It's from MMWR, which is the Morbidity and Mortality Weekly Report for the epidemiology nerds in the room. That's the CDC thing where they put out bulletins about all the late-breaking kind of stuff. And this was a case report of a nursing home. I'm sorry, not a nursing home. A choir practice at a church in Washington State, and they had 1 symptomatic person. That's this red guy over here. And they had, I believe it was a 2-hour choir practice. And after that single exposure, there was 32 confirmed and 20 probable cases. And that means they got sick. They just didn't get tested. So 52 cases, or 87% of the people that were in that room with that case got infected. And the only people who didn't are these people right here at the front, who are about the furthest possible distance away from that person you could be. Now, we talk about 6-foot social distancing, right? This has got to be more than 6 feet here. It's got to be. And if this one person's stuff can get all the way over here, what does that mean about restaurants, movie theaters, whatever else? It means that we still need to be careful. It means that even if things are reopening, you have to behave with some caution to keep yourself safe. So, restaurants are reopening. Am I taking my 80-year-old dad out to the restaurant? Not a chance. Not a chance. We're not doing that. And so I think you still need to I think you still need to be cognizant of this stuff, and you still need to take precautions, not only at work, but at home. And you need to make sure that you are protecting yourself. I feel like I should put up a more professional background since this is being recorded. And you still need to wear your PPE. You still need to, wear a dang mask when you go to the grocery store. There's a reason for that. People should be wearing masks out in public all the time. I know that as things open up, for lack of a better word, there's a sense that, oh, it's over, we're all done, we made it. That is not the case. We flattened the curve. We did not squash the curve. There are still people that are getting infected with this virus right here in Pinellas County every single day. The virus is still here, and we should not act as though the risk is over. Now, we did amazing work as a community, and that seems to have flattened that curve out, but that doesn't mean that the virus is gone, and it doesn't mean that this is over. And I, to be very frank, I've seen a couple of things come across my desk in the last week or so where people are not wearing their PPE when they should be. And that is just not acceptable. I know it's a pain in the ass, but we've got to do it. I'm going to go work my shift tomorrow, and I am going to wear an N95 mask for 8 hours straight, or 10 hours, or whatever it is. And I'm going to go from an N95 mask probably to a full face respirator if I have to intubate somebody, because the risk is still there. And I still don't want this virus. And I'm still hearing of people getting infected from being in the same room as people. And that means that we really need to stay diligent on this. I know it's not easy, but we have not had any occupational exposures. We have not had anybody, knock wood, pick this disease up on duty, and I would very, very much like to keep it that way over the next 6, 9, and 12 months. How's that for a soapbox?
Here, here. That's what I say. That's good. Yeah.
I agree.
It looks like, I don't know whether it's just mine. Maybe I'm not live. Oh yeah, that's because I'm not live. There you go. It was like way delayed, but okay. All right. Michelle was on a meeting with us earlier today and reminded me of something I wanted to mention to the whole group. So I'll do that real quick. The yellow pandemic card, right? The yellow, condition yellow, COVID-19 specific treatment card that we've been over a bunch of times and that everybody should be using for any suspected COVID patient, includes lots of things to do and lots of things not to do. And I think it's worth emphasizing that some of those things, like for example, withholding Solumedrol, really should be done only when you suspect a COVID. So remember that the defining characteristic of condition yellow is that we are having some impact to our operations from this issue, but we are not yet at a point where the standard of care needs to be altered. And so for a suspected COVID patient, we want to withhold Solumedrol because we have some concerns about whether that's helpful or harmful. But if you do not suspect COVID, you need to treat the patient according to standard of care, normal protocols, which is every asthmatic or COPD exacerbation should get Solumedrol unless there's a really good reason why not to. And I know, I think we're over the thought process of maybe only the really bad ones need Solumedrol. That's pretty old school kind of stuff. So if that's something you still have in your head, please just recognize that that's not our standard anymore. I challenge you to get through a visit to an ER for your asthma exacerbation without receiving steroids. It won't happen unless there's a really good reason why you don't need steroids. If you're not giving the steroids, you're really only treating half the disease. So if you suspect COVID, then by all means withhold the steroids. But if you don't suspect COVID, do the normal standard of care for these patients.
And pretty much all the other changes that we made were based on the safety of their responders.
Mhm.
So this is the only one that really affects what we're treating the patient differently because they're suspected COVID. So obviously,
Well, yeah, I mean, there's also the tolerating a little bit of hypoxia if we can't get them above 85 with
Right.
non-invasive oxygen, which I wouldn't be necessarily excited for us doing in somebody we don't suspect COVID in. But I guess it's just important that the yellow placard is all about protecting you and then making a couple of tweaks when we do suspect COVID. And if you don't suspect COVID, then we shouldn't make those clinical tweaks.
So this goes back to making sure that you're doing a full assessment and questioning and talking to your patients and family members. We know it's really hard when you're in full PPE to communicate, but if you don't have all that information, it's going to be really hard to make the clinical decisions that you need when you're treating your patients. So that tool I brought up earlier is one way to do that. Chief Morelli's microphone is another way, but really communicating with people and getting a full history is important on these patients.
Absolutely. By the way, you like my white coat? Look very official.
It wasn't just for this meeting.
No, it wasn't just for this meeting, I promise. Ken Ticket says, complacency creep. Yep, that is the deal. It is easy to get complacent, but we really can't let that happen. What else you guys got? What else did I miss out on?
There was a good question about prolonged use of N95s on the clinician, and towards the beginning of the chat. You can go back up there.
I believe you jumped in on that a little bit. Have you looked at any research studies on that at all?
I have not.
I haven't either. I will take a look for a few minutes and see what I come up with.
I'm sorry, I'll be right back.
He was just kidding. He's not really here. Right.
Now time for Chief Zeppetto to sing.
Yes.
Why does everyone get me to sing? Okay. Feel an 80s song coming on, maybe.
So I'm sure there's going to be more and more research studies coming out that are going to be very interesting and are going to change the way that we really think about this disease. But I will take a little time to look into this because I keep seeing this hypercarbia and I've never seen any studies on it.
Well, it is an interesting thought. I mean, have we ever had this many people in this much PPE and respirators for this long of a period of time in history?
We could do the studies now.
Yeah.
We have actually a couple ongoing studies, so I don't think that's going to make it to the list. But I think that maybe because this is being talked about so much that we might see more information on it because it's only as good as the information that's out there and the studies that have been performed. So,
and you may see studies from industry where people use respirators or stuff all the time in manufacturing and different stuff. So there may be studies out there of ways that, to combat that. I mean,
I don't know if that's even really a concern, but I think that we got to dive into the research and see what's out there. But it's interesting to see it pop up on social media without any backing. So, of course, that'll open the door. And if somebody wants to prove it, then they can do some studies too.
Oh, they also said Chuck Norris died, which was a myth. Nothing killed Chuck Norris.
No.
No way.
No. Actually, Chuck Norris killed COVID.
Yeah, exactly.
They got upset.
Yeah, don't make me get my my opinion sign. You know my opinion sign?
No.
It says if all we have is no, it says what the hell does it say? It says if we have data, let's talk about data. If all we have is opinions, let's go with mine.
I like it.
Some famous guy said that.
Should we print it and hang it up and put your name under it?
No, don't put my name under it. But I do have it printed in my office for when somebody wants to come in and talk about the latest, greatest thing they saw that they want to put in the system. Got to show me the data.
I'm sure you know what I'm referencing.
Got to show. Yes, I do.
I think I saw the one I liked was it said real scientific data is not not post it directly to YouTube.
Yeah, that's a thing.
You have to
It
pay for
was
this. You have to pay
Jim-
for the subscription to get the whole article.
It was Jim Barksdale. Here it is. I found it. It says if we have data, let's look at data. If all we have is opinions, let's go with mine. Smart guy, huh? So I have not seen anything objective or data regarding increase in retaining carbon dioxide in folks using respirators for a long period of time. I tend to doubt it because there is a one-way exhalation valve on the full-face respirators that allows very unimpeded air to exhale. And I think the amount of rebreathing within the nose cup of the mask is probably relatively small. But somebody should surely study that.
I'm seeing it about surgical masks and N95s as well.
Surgical and N95s.
Yeah.
How do you rebreathe CO2 from underneath a surgical mask? There ain't a lot of space there. It's not like breathing in a brown paper bag, is it?
That's what they're connecting it to. That's what I've seen on social media.
But
That doesn't.
Yeah, to retain CO2 because of rebreathing, you have to breathe back in the same air you exhaled to a large extent. I don't necessarily see that happening under a mask because there's just not that much space in between the mask and your face. And number two, the only other way that you would retain CO2 for that is if you decreased your minute ventilation and had essentially a respiratory acidosis. Also, maybe not. I tend to feel like I'm hyperventilating when I'm wearing the mask, but I don't know. Somebody should measure it. Easy to do. Who wants to volunteer to have ABGs done? Ken Ticket said PubMed. Ken, did you find something on PubMed?
Post it up.
I haven't done a PubMed search. I mean, I can do one, but. Josh says, not sure if it's just me, but seems like stroke STEMIs are up. Have we looked at the data yet? And when it started trending up, or have sepsis increased also? Not sure if it's just me, but seems like stroke STEMIs are up. So I don't think that we've seen stroke STEMIs up directly, Josh, at least not in data that I've seen. We saw respiratory as a percentage of total complaints up, but I think that the distribution of complaints is changing very quickly over the last week or two. So stand by, we might see that. Ken, post the link, man. We tubed a stroke lady. I love it. A stroke lady. Is that like the church lady? We tubed the stroke. Do you remember that Saturday Night Live skit? Or am I too old for all of you guys? So, yeah, isn't that special? That was a good one. Jasmine, do you know who the church lady is? There's no way you know who the church lady is.
No, I'm reading this article that Ken just was talking about. So let's see what it says.
Great Dana Carvey.
It was Dana Carvey was the church lady. There you go. So
Just before my time, it really could be.
We tubed a stroke lady last week, presented more like a bleed with insufficient respirations. Are we supposed to call OLMC first from a facility, possible COVID? Well, yeah, Peggy, if you suspected it was a COVID patient, we'd want you to be very, very cautious about that too. I hope that you would do that tube following all of the condition yellow safety measures. But if my memory serves me correctly, and it's been a long day, but if my memory serves me correctly, intubation is not 100% prohibited under the yellow card. It's just cautioned against. So if you felt like that was the right thing you needed to do for your patient and you took all the appropriate precautions, I guess you could make an argument for that. But if you really suspected that the issue here was COVID, or if you knew it was a COVID positive person, I really hope you did that in as safe a way as possible. Oh, Dr. Smith is in the chat, but he didn't join in on the video. What the heck, man? Yeah, the other thing you can do is just email Dr. Smith with the title of the article you want, and he'll pull it from the USF library for you. How's that for payback, Andrew? All right, so if you didn't suspect that it was COVID, Peggy, then that's fine. I hope you still took all the precautions in terms of an aerosol generating procedure. I think that's super important because, again, we have asymptomatic stuff, so you never really know for sure. So, Jasmine, do you have that article up? Can you share the screen?
Oh, yeah, I can do that. I'm over here reading.
Sounds like something we need to look into. Because, you know, we read it on the interwebs, right?
Yeah, I don't think the results were that there was any effect.
Can you scroll up for one sec? Okay, so this is from Respiratory Care in 2010.
Yes, it's 2010.
From some folks who are at OSHA and CDC. Okay, good. So,
Want to see the results?
I'm reading the abstract. Hang on.
Oh, my bad.
Oh, a transcutaneously measured PCO2. So we have to stop there and have a sidebar about whether or not the RAD57 is accurate. Or no, wait, that's CO. Never mind. Different. It's probably the Massimo Rainbow. Okay, so how many people did they do?
10.
10 people, and
Yeah,
2 people had transiently elevated CO2?
It's a very small group.
Yeah, hard to go to the section. Is there a section where they discuss the CO2 and which people had it? How about one more down? So none of these p-values are significant.
Mm-mm. I'm going to keep going unless you want me to stop.
Stop for a second. Stop for a second.
Okay.
All right, next one. I'm trying to get to the part where they discuss the CO2 results. There it is. There it is. Wait, you went past it. Okay, so an average CO2 increase of 1 plus or minus 4 millimeters of mercury after 4 hours. Hard to say that's going to be clinically significant, but that's just an eyeball of the paper. So
also looking at the test group, it was 10 people, and I think their exclusions were like pregnancy and like, I mean, it's a small study. It would have to be repeated with a larger
and I
group.
think where you just had the next page up, I think it says that was in a smoker or an ex-smoker.
Okay. Let's see.
I think you went past it.
Oh, geez. How fast do you read?
Right there, right there. Compared to control, CO2 did not differ significantly by work rate or model. There were modest absolute increases over 1 hour compared to baseline of basically like 1 plus or minus 4 after 4 hours. Yeah. Well, so yeah. So it's hard to say that that's clinically significant. If you pass out from raising your CO2 by one or even 5 points, we got bigger fish to fry. So I don't know. It's worth looking at though. Okay, here, let's see what the comment says.
Here's your limitations right there. That's what I was saying. You need to repeat this with a larger group.
Yeah, so it says it's a possibility, but again, it's only 10 people, so it's hard to draw much of a conclusion. Yeah, I agree. The full face mask is in some ways less comfortable than the N95. The problem is making sure that we stay sustainable here as this thing goes on. So something we should probably look at a little bit more. Maybe Dr. Smith will undertake a little literature review on whether that's something that we need to be concerned about. And then I'm a dork. Didn't I answer that question before or no? Is there a different?
I don't remember you answering that question.
I thought I answered in the comments, but maybe it didn't go through. I said that Florida dashboard, as you've all seen in the news, had some concerns about its accuracy or reliability. It sounds like somebody who maybe previously worked at DOH but left or something like that.
I read that.
Yeah, did you guys see that in the news? I think that's what he's referring to. So I know that the death counts match what the medical examiner is telling me, so I'm pretty confident in those.
The death rates for Pinellas County.
Yep. So the number of COVID deaths in Pinellas County matches between what's on that dashboard and what I am being told directly from the medical examiner. So I'm not sure how to get a better source than that. As far as the rest of the numbers, I can't personally vouch for them, but it is one of multiple places that I look to try and understand what's going on with this thing. So, for example, one of the places I look is the hospital data that I sort of mentioned to you a little while ago, and that comes directly from the hospitals. So it doesn't even go through anybody else. They enter the data directly into the spreadsheet that then populates the dashboard. So I'm fairly confident in that data. A lot of the testing data is coming from hospitals and private labs as well. So that dashboard is really sort of a place to put everything together, just like the Hopkins dashboard. But the data feeds that go into it, in large part, we look at in other places as well. So I wouldn't say that that dashboard is solely driving policy making or decision making or anything like that. Hopefully that answers the question. All right. What else we got? Sorry I was late. I was on the Board of County Commissioners meeting and, you know, politicians.
So
Dr. Cho was supposed to join us this afternoon, but he was also hung up on the county commission meeting, so he couldn't. Is there somebody else that you guys want me to try and bring on? I know Chief Tedesco wants me to try and get Dr. Osterholm here, but I think that's unlikely given what his schedule looks like. If you want to.
Peg brings up a really good point about, you know, that wearing a face mask a lot psychologically for everybody. That's a good point. And being in all this gear takes a toll on you. And that's something we're really focusing on for future CMEs here, and to get out there as the word that it is psychologically very hard on us, we're not in it every day, and I acknowledge that. But it is psychologically hard on everybody and mentally exhausting. Plus, I'm sure, like my department and a lot of departments, they've, you know, suspended any additional annual leaves, and people don't have time to take off and just decompress. So there's nowhere to go. so to speak. It wasn't. So that's tough. So you're right on about that, about being tough psychologically for everybody. And that's why we're saying thank you for doing such a great job and continuing to do a really good work out there. But it does get hard. And if you are feeling that way, you start to that point where your cup runneth over, reach out to people. That's what everyone's here for, is to give you guys a hand.
Yeah, these aren't very normal times right now. Just remember your patients are having those same feelings. They're not wearing PPE, but their lives have changed a lot, just like all of ours have. Shane Hudak mentioned Dr. Antevi as a possible guest.
I'm emailing him right now.
Great.
He had unfortunately a little bit of a personal thing go on this week, so I doubt I'll get him this week or next week. But I'm asking him if he'd be willing to come on at some point.
So as we were talking about the dashboard earlier and we were looking at research studies, I think that this is a time for people who are not really diving into research to realize where things come from. That information about the dashboard is the same. The epidemiologists get the information from our patient care reports and from the hospitals and other places. But if you see people questioning data and where it comes from, that is a really good thing for people to do, not necessarily saying that that is not valid data, but looking at, I mean, you're pulling up information, even if it's from CDC or DOH, or you're finding it from a research study, you really have to get to the bottom of how they got that information to where it is. So it's very interesting once you start looking into it. But
Yeah.
that information comes from our local information comes from our patient care reports, comes from testing from labs, it comes from the medical examiner and the hospital reports. It's all compiled together. So data is only as good as who reports it. Remember that when you're writing your patient care reports and giving a report at the hospital, that information filters through a whole bunch of different places.
Yeah, critical thinking is always a good thing. It's always a good thing. Questioning is important. Dr. Smith, are you still on? If you're still on, let me know in the comments, please. Okay, any other questions or concerns? Anything else we want to talk about this week? It's going to be a whole week before we are back together like this, but certainly questions can be tossed up in the meantime. I think my biggest message is just because things are, again, for lack of a better word, opening up, please do not let your guard down. Please do not, either at work or in your personal life, do things that would put you at risk. Continue to do the physical distancing from people, which I think is a much better term than social distancing, but please continue to do that. Continue to keep yourself safe. You know, I wish everybody was wearing a mask in Publix. I'm still wearing a mask in Publix and wherever else. So I would encourage you to do that as well. Not necessarily for your own protection, but to protect others. We as healthcare providers are high risk. You know, see, like Chief Morelli right there is coughing all over the place. Mm-hmm. You know, we're high risk, and the point of the mask is more to protect others from you than to protect you from them. So, you know, if I get invited to go to dinner with somebody, I have to have a thought about, you know, yeah, I was with a COVID positive patient yesterday. Is that a good idea? And what kind of personal responsibility do I have to make sure that I am not passing this virus to anybody, even if I feel fine and, you know, I still could be asymptomatic. and shedding. So, there's an added level of responsibility and thoughtfulness that I hope you all would take based upon your role as a frontline person in this. And I also hope that just for the sake of your families and everybody else, that even though things are, quote unquote, opening up, we still need to be smart. We still need to protect ourselves and not let our guards down. We are lucky with the level of being affected, but I was on a phone call earlier today with EMS docs from around the country, and one's going, well, I've got 17 people, but nobody's still on a ventilator. This is still a real thing. So please don't let your guard down. And Chief Handoga retracts his dinner offer. Good, because I was going to have the waiter spit in your food. Whatever. So look, just please stay safe. Please don't blow this off. It's not over yet. It's not going to be over for a long time. Maybe months, maybe a year. Maybe we'll get a vaccine 4 months from now, and we'll all run around vaccinating each other and vaccinating the community. But don't bank on it, okay? Like, how long has the common cold been around? That's a coronavirus too, and they don't have a vaccine for that.
I think you're right, Doc. I think we have to, as responders, we need to show respect to the community. We need to show respect to each other. And by wearing a mask and setting that example, hopefully sets a trend for the community to see that we're out there trying to do everything we can for them. We all take, an oath, for lack of a better term, to really to do our best and to do no harm and to really try to help people. And I think we need to be those trendsetters, and we need to be the ones out there saying, hey, it's not okay. You need to wear a mask and try to, do the best we can to protect ourselves, but not only ourselves, but the community. Like you said, you don't want to walk in. I personally don't want to go over to my parents' house. I stay, 10 feet away when I got to go over there to do something for them. I know that they're the vulnerable population,
I haven't been at my parents' house since January.
Is that because COVID?
Yeah, it is. I mean, they actually literally just moved to town at the end of January, and I barely seen them.
I think it's important to remember that the when we talk about the masks in public, that we're doing that to protect others. I know we keep saying that, but the things that I hear a lot of conflict about are about if you are sick, you put a mask on. And that's not how this works. This is, we're worried about asymptomatic spread, and I could be sick. So even if I didn't know it, so I'm going to wear a mask so that 70-year-old in front of me in line at Publix doesn't get sick as a result of standing beside me.
Yeah. So I guess what I would say is please maintain your physical distance or social distance or whatever you want to call it. Please keep wearing a mask when you're in any kind of scenario where you can't maintain that distance. And please stay safe. Wear the appropriate PPE when you're with patients, whether that's baseline or whether it's the full thing if you're doing something aerosolized or you suspect COVID. But don't let your guard down. Please don't let your guard down. Hey, you know what? The last thing I want to say, if there's no other questions or comments, is Happy EMS Week. What an interesting EMS week we're going to have this year. All of our symposium for last week got canceled. All of the cool stuff we wanted to do got put off. But I think last week was Nurses Week. And I think this week is EMS Week. And it's maybe down low on the list of priorities for people, but it's worth taking a minute and just saying thank you. You guys do an amazing amount of work every single day. You care for untold numbers of patients. You're there for them in their best moments and their worst moments. And you do it with kindness and with compassion and professionalism. And it's a privilege to work with you and a joy to watch you guys do that work. So thank you very much. Okay, last chance for questions. Yeah.
Yep.
I got another call I got to get on pretty soon about.
Oh, geez. All right.
nurse-
Any
these
other
nursing home
questions?
things. So, yeah, you want to trade schedules, Jasmine?
Oh, my schedule is just as busy. Don't worry. You
So,
guys keep making CMEs to do.
right, Chief Morelli.
No.
Any last words?
No, nothing else for me. Just like you said, happy EMS week. Thank you for everything you do, folks. We really do appreciate it.
Chief Cepetto.
Roxanne.
Yes.
Okay, there it is.
Wow.
Told you it wasn't going to be good.
My life is now complete.
Yeah, wasn't going to be good. No, again, thank you for everybody for doing what you're doing. You guys are doing a great job. I said it a few times today, but you guys really are doing a bang up job out there. And it is really an honor to work with everybody. Hopefully everyone's keeping safe and healthy. And like I said, if you guys, anyone needs anything at all, please reach out. Don't let this, don't all this, compile to where you blow up. So just reach out and get taken care of.
Yes. Happy EMS week, everybody. Thank you for tuning in. Stay in touch. Let us know if you need anything. Stay safe out there. And we will see you next Tuesday. Same time, same place.